Ladies and gentlemen, welcome back. One of the major things that I'm trying to bridge here through videos and social media is the broken education system, because frequently I see what I call the double dependent healthcare model. So, and this is all naturally evolving over the last couple decades. And there's a major problem, and why I call it the double dependent healthcare model is we have patients that come in and we're too dependent, the public is too dependent on emergency care. You know, I see people and I ask people a lot of questions. When did you start throwing up? When did your cough begin? You know, so on and what have you. And you'd be amazed at how quick people come in for a cough. They've been coughing for 3 hours. They've been throwing up for 45 minutes. And they run to the emergency care. So you're going to get overprescribed radiation. You're going to get overprescribed medications. Oftentimes, you're having real pains. You're having real symptoms. You're throwing up. You have nausea. You have diarrhea. We CAT scan you, and it's negative. But you're still having the pains. You're still having the same symptoms. So medicine is a practice. You're going to get practiced on, and we are the guinea pigs of modern healthcare. You know, nobody knows the long-term interactions, the long-term effects of all these medications that we put in. So aren't we looking towards natural routes first? And it's because we don't know about them, right? Our educational system broke, like I just said. So we need to start retraining our body and learning how to take care of our bodies within the home before our reliance. So because of that, we've created a culture of, I think it really started with the whole McDonald's thing, with the whole coffee spilling on the lady, and she sued McDonald's because it was their fault that they served her coffee that was too hot. What? So now we see slip and falls. We see people suing people over everything else. So going in terms of healthcare, people are putting junk to their body. Our body turns to what it's really doing to our body. But it says low calorie, it says low fat, it says reduced fat, but I'm gaining weight, I'm getting sicker, I need more insulin, I need more prescription pills. So if the food I'm putting in is less calories and is supposed to be better for me, why am I getting sicker and sicker? Why is the public getting more dependent? So because of this, and because of this whole crazy evolution that's occurring, healthcare model in exchange has to cover everything. So guys, if you say the magic words in the emergency room, if you say chest pain, you're going to get a chest workup. You're probably going to get a CAT scan to make sure there's no blood clots in your lungs. Most of the time, they're going to come back absolutely negative. Once again, you're still really having these pains. So what does that mean? It's usually from the junk they're putting into our body. But that's the part of the education that's missing, both within the healthcare model and at home. So we go right to the dependence. So like I said, there's the first half, which is the dependence of the public on the healthcare model. And then in return, us as healthcare providers have to rule out everything that you say, because if you further your progression of your disease or something that's going on in your body and we don't catch it and you come back and sue the hospital, that's why everything has to get ruled out. So you're going to get overprescribed radiation, you're going to get overprescribed medication, you're going to get overbilled. And both sides, you know, there's not an even exchange, there's not an even scale. Both sides are raising at the same time. So we're creating this double dependency healthcare model. And I mean, it's going to create a bubble sooner or later, right? The healthcare cost is going up. Like my grandma was just in there for 4 days, something that we could have, she was a cardiac patient, but she didn't really need to be in the hospital for 4 days for one ultrasound to get her blood pressure medication and her Lasix, her fluid excretion medication, because she was overloaded with fluid. Get those balanced. We could have done this all from home, all with the close care from a physician, from her office right up the street. And these are the reasons why healthcare costs are going up. And this is what's really starting to piss off the public and make people angry, both at home and the people who work within hospitals. So hopefully you've watched it this far, and hopefully you can look to me to help bridge that gap between what we're missing at home and what we're missing in the hospitals, and bring the two together. Because I'm not against one side, I'm not against the other side, but we have missing links. And there's a lot that people are missing, and we're over complicating health. We're chasing potassium, we're chasing one lab value, or one blood clot factor, or this and that, and then so we're prescribing a pill based on that. But we're not looking at one step behind that, which is what caused that in the first place, right? Our healthcare system is about chasing symptoms. So let's start looking at root causes, breaking those down, individualizing those approaches, and getting to the bottom line so we can better treat your care, drive healthcare costs home, and keep you out of the hospital, keep you healthy, and keep you living and feeling good. All right, y'all, stay safe. Stay healthy, protect yourselves and protect yourself. See you on the next one.